think Akash got logged off again.
Yeah, he's
Yeah,
joined.
he's back. Okay.
Yeah.
Akash, is there a connectivity issue?
I don't think so. I have a Wi-Fi actually. I don't remember.
Okay. All right. So you can share your screen, Akash, and I'll get started. Okay.
Yeah.
Okay. So hello and good evening, everyone. I'm Prarthana, and it is indeed a great pleasure for me to facilitate this webinar today. I would like to welcome each of you to this session that is being conducted specially for FFE medical scholars. Thank you so much for making yourselves available. I would now like to introduce you all to our speaker for the evening. Dr. Akash Gopaldas G. Moore is an FFE alumni and has completed his MBBS from Dr. Shankar Rao Chavan Government Medical College, Nanded, in 2016, and his MS in General Surgery from Seth GS Medical College and King Edward Memorial Hospital, Mumbai. He's currently pursuing his MCH in Surgical Oncology at Tata Memorial Hospital, Mumbai. In his free time, Dr. Akash enjoys reading, acting, and playing the flute. Welcome, Dr. Akash, and we really appreciate your presence here. This is totally valuable to our FFE scholars, and all the more because you are an FFE alumni. Thank you so much for agreeing to do this session. We also have with us the Managing Trustee of Foundation for Excellence, Dr. Sudha Kidao, present here. Also present are Anandita and Sushma from the Alumni Relations team, who have helped organize this event. I request Dr. Sudha to just quickly say a few words.
Hello, everyone. Good evening and welcome to this virtual meet. I'm delighted that we have Dr. Akash Moore with us this evening to share his experiences as a student and his journey and his learnings with all of you. I think this is a very important forum because I think when I was a student, I wish I had someone who could guide me and tell me what to do and what not to do. It's a wonderful way for all of you to learn without having to reinvent the wheel. So I hope all of you will pay attention to what he's about to share with all of you. Welcome, and I'm really delighted to see that we have a large number of participants today, all of you MBBS students in various years, in various colleges all over India. Welcome to this sort of national forum where you're all in this together. Thank you for coming. And I want to thank the FFE team for organizing this. Prarthana, Sushma, and Anandita, thank you for making this possible. And without much ado, I'd like to pass it on to Dr. Moore. And let's hear what he has to say this evening. Thank you.
Thank you for the introduction. I'm really glad actually. Good evening, everybody. We have 226 people here. Actually, when I heard this, I have to speak something about MBBS or two MBBS students, I had only one thing in my mind, that as we are evolving, we are changing from textbook learning to coaching in MBBS. And I think being a scholar, it was everybody's dream. Like doing MBBS is most probably everybody's dream. Okay, nobody is, I think, amongst the participant is like forcefully made to do an MBBS in private college or somewhere else. Okay, so it's a journey through our dreams. That's what the topic means. And you can see the meme on left hand side that we generally, when we think of MBBS, first thing comes to our mind is the duration. Like it's like a 5.5 years course, then you have to do MD and MS, then you have to nowadays you have to go for a super specialty, and then you have to go for a subspecialty. So I think it's not the time which matters, it's the quality of your journey which you're enjoying. It's not the destination, it's obviously the journey which matters. So that's why I'm discussing you about something about my journey, and as well as I'll share you about the some of the experiences which I have which I have experienced while doing MBBS.
have we lost Dr. Moore?
Yeah, I think we have lost his, there's some connectivity issues from his end.
I'm sure he'll join back.
Yes, yes. Let's just give him a minute. Yeah, I think we'll just give him a minute and he'll be back. He's facing some network issues.
In the meanwhile, I'd like to tell all of you to please make sure to create your renewal application and start the process of sending in your renewal scholarship application just as soon as you can. Yeah, great.
You're not audible, Dr. Akash?
Yeah, sorry.
Yeah, okay, yes.
Okay.
Yes.
So what I was saying is, during my 12th, I always was about to like, I will become a software engineer. Then at that time, I saw that 72,000 engineers were unemployed by Air India. So I thought ki engineering is not the field. It's like not the secure field. Then I decided to will that I'll do both maths and bio, and I'll see where my interest goes. Actually, I was interested in both the subjects, but then my interest grown in biology. Then I took MBBS. After MBBS, I've decided that I'll do a neurosurgery, MCS neurosurgery. Then, while practicing in MS General Surgery, I saw that many of the neurosurgery patients who are suffering from head injury, we are like, it's not in our hand. There is so much of morbidity, so much of mortality. You will operate the patient, but I don't think I'll benefit anybody by doing that surgery. So that's why I decided I'll do a surgical oncology, because malignancy or cancer is the thing where people know very less about that, and they directly go like cancer is equals to death. Like if anybody is suffering from cancer, he is going to die some or the other day, but they don't know the truth that we can improve the quality of life. So that's why I chose to become a MCH surgical oncologist. So in my life, decisions matter, and I made those decisions as my dreams. So I think dreams like can be changed according to the scenario, your likes and dislikes, or whatever conditions you come across. So secret behind persistence. Actually, in 12th standard, I had a rank of Maharashtra CET rank of 445. Then during my PG rank was 38, and I had this super specialty CET rank was All India rank 2. So what is the secret behind this persistence was fear, not fear of failure, but it was fear of repetitiveness, that I don't want to repeat the same syllabus again for whole year and give the exam and wait for the results. So that was the fear which was growing in my mind. So I I thought of giving it one shot, and I got it correct. You see this video, I think this video suits our scenario. So I think the slide is named as "Are we evolving or revolving?" Actually, as we are growing now during 11th, 12th days, as you remember, we have like we don't go to college, we don't want to attain any practical. We just want to go to coaching classes, learn about entrances, give the entrances, crack the entrance, and come to MBBS. Okay, but now this scenario is again happening with MBBS. Everybody, as he joins first year, they join some or the other foundation courses in the various coaching classes. They go reading MCQ books instead of reading textbook. Okay, and okay, fine. After reading those MCQ book, obviously you will crack the CET or entrance test, whatever is there. You will crack the entrance test, but after coming to MS, when you clinically see the patient, you have to again go back to those textbooks. Like you have to read anatomy again, you have to read physiology again. So instead of evolving, we are revolving around the same. That's what the slides means. Okay, so that's what today's topic I want to cover is we don't be focused on entrances, read textbooks. I'll show you how textbook can help you and how much people have put their efforts to put different concepts in front of us. Okay, so let's get started. So this thing, how to enjoy the journey. Obviously, MBBS is like whole bunch of books, bunch of syllabus. Every year you have 3 subjects, 5 subjects, 6 subjects, but we can't finish it off as like just one night before, as in engineering. Engineering is like
I think we've lost him again. Dr. Akash, are you there? All right, we'll just give him a minute and Dr. Akash will be back. Yes, he's back.
So can you identify the region, which region of the body is this? I think it will take time. So I'll tell you, this is the patient of breast cancer, which we have operated. We have done a modified radical mastectomy for her. She procedure went uneventful. Post-operative also was uneventful. She went home very well. And suddenly the relative comes to me on post-op day 8, showing that the patient started growing new bone over. So what do you think anatomically would have happened intraoperatively, which has caused a new bone to grow? It's not a new bone to grow. Are we getting any reply?
Yeah, please use the chat box and interact with Dr. Akash. Can you repeat that question, Dr. Akash?
Yeah. So this is the patient. She's operated case of carcinoma breast. It's an intraoperative picture after after the surgery. Okay, and I'm pointing out the structure which is causing one patient to have a winging of scapula. Okay, let me simplify it. Winging of scapula is caused by which damage to which nerve, which is very common in post mastectomy patients.
Yeah, please use the chat box and you can answer the question.
I think it will take time.
Yes, long thoracic nerve.
Yeah. So that's the nerve to serratus anterior. And
Yes.
can you see the nerve actually? Can you identify it differentiately? No, because it's not visible separately from the other structure, and this is what happened intraoperatively. That's what I want to show you. You have to know the relation of long thoracic nerve, how to go to that long thoracic nerve intraoperatively to prevent it from injuring. Okay, otherwise you will end up injuring the long thoracic nerve and patient won't be able to lift any weight post-operative. That's what quality of life you are giving. If you don't know the this is the nerve which commonly people just know MCQ point of view that winging of scapula is caused by long thoracic nerve, but they don't know the relation or the course. Can you tell me the course? Actually, it's very long, but it's okay. So reading anatomy is very important for obviously not even surgical but medical faculties also. Okay. Second is forensic medicine. Forensic medicine, I think, it's the most neglected subject. Many colleges don't have the department for forensic medicine, different department for forensic medicine in their colleges or any teacher. Generally, people just get passed in forensic medicine. But nowadays, this subject has become very important for us. Okay, because anyone who wants to practice outside, you should know forensic medicine thoroughly. You should know what defenses we have. Okay, so I'll give you example of each. What is the act of omission? Act of omission is something that a reasonable doctor will do. You omitted. Okay, that means suppose some patient came to you, okay, for termination of pregnancy. Okay, you took that patient and that patient had cervical pregnancy. As you know, cervix has various sinuses which won't stop bleeding. Okay, if you could have done a ultrasonography pre-operatively or pre-procedure, it would have prevented her from bleeding and leading to hysterectomy. So she sued the doctor for that thing, that you should have done a ultrasonography pre-operatively and prevented her from bleeding and leading to hysterectomy. So that is the thing. So
Dr. Akash, can you hear us? I think we've lost him again. Yes. Okay. He's yeah, looks like he's facing a bit of network issues. Dr. Akash, would you like to keep your video off if that will help with your connectivity?
connected with now different network.
Okay.
Okay.
So second was act of commission. Act of commission is like you have committed anything which a reasonable doctor won't commit. That is leaving a mop or leaving an instrument during surgery. Okay. What do you mean by privileged communication? Anybody?
You all can write on the chat box, what do you all know or what do you all understand by privileged communication as a part of forensic medicine? Okay, no responses.
Yeah, no responses.
I
Students,
told you, no, this is the most
interactive.
neglected subject. Privileged communication is
Yeah, so somebody has written saying maintaining the secrecy of the patient but informing those who are legally bound. Communication with state instead of,
yeah.
Privacy.
yes.
No, this is not correct. Communication with state instead of privacy. First one is correct.
Minimum communication that a doctor should make with patients before a procedure.
No, this is also not correct. Privileged communication is keeping the confidentiality of what is patient's information is. Okay, so I'll give you one case scenario. If any patient, Dr. X is there, he went to donate a blood to one blood bank at Apollo Hospital. Okay, so he donated a blood and he turned out to be HIV positive. During blood donation, generally nobody will reveal the report of your viral markers. Okay, and he was about to get married to Mrs. Y, Miss Y. Okay, and suddenly Miss Y's relative came to know that he is HIV positive, but they just wanted to confirm, and they went to the Apollo Hospital. Apollo Hospital revealed the report of the doctor to the relatives, and the marriage was broken. So the doctor sued that hospital. Is that correct? Yes or no? Just give me the answer in yes or no.
Scholars? No, one says no, one says yes. More of no.
This is the case scenario from where actually our India has adopted this privileged communication law. Actually, there was two things in this. One is confidentiality of patient's information or patient's report, and second is uh, the woman's power to have life. If she would have got married, so she would have suffered HIV infection and she would have died prematurely. Okay, so it was confidentiality versus life. Hello, am I audible?
Yes, yes, Dr. Akash.
Yeah. So it was confidentiality versus life. So that's why the Court of Law, Supreme Court of India, has given the judgment on privileged communication that the hospital was correct in disclosing the information because it was the question of life, which is more important than the confidentiality. Okay, so that's why knowing this acts is very important. Now, will you still neglect? Next is error in diagnosis. Okay, suppose one young patient, 22-year-old kid, was admitted with me, and what happened is he was complaining of right testicular ring. I've diagnosed him as epididymoarthritis. I've given him antibiotics, analgesics. Okay, he improved, but after 24 hours, his pain got worsened. Okay, so his pain got worsened. He went to other doctor. He did ultrasonography. He found to have a testicular torsion. He did orchidectomy for that patient. That kid sued me. So, what is my defense here? What do you think? What is my defense here?
What do you think is Dr. Akash's
As
defense?
what should I speak in the court of law? That I was not wrong.
What should be his justification, right? So there's emergency condition.
Emergency condition.
One of them says emergency condition. What else? Vastness of medicine.
Vastness of medicine, clinical features with mild pain. No, it was severe pain. It was acute pain actually. But as I was practicing in the village, so ultrasonography was not so easily approachable there. That's why I thought he's having epididymoarthritis. So it's basically my defense is differential diagnosis. Always a rare case, so not diagnosed. No. Sorry. So basically, it's a differential diagnosis. Always, whenever you read epididymoarthritis, you will always see that differential diagnosis of epididymoarthritis is torsion testis. So you can say the features of both the conditions are okay, and not doing the ultrasonography is not any reasonable thing for a doctor to be sure. Teleconsultation. Next one, teleconsultation. For teleconsultation, uh, this teleconsultation law, as you know, it came recently. As one doctor, family doctor, one patient called up in the night. He was telling that I am having severe epigastric pain. Doctor told, take 2 tablets of Gelusil and sleep. Okay, that patient died in the morning, and the relative sued that doctor that due to that Gelusil the patient died. Okay, but this teleconsultation law has protected the doctor because that patient was having myocardial infarction, okay, which can present with epigastric pain or similar features. So what the teleconsultation law says that you should not message any prescription or any medication on WhatsApp or phone call. Any prescription, if you want to keep, you should write it on the prescription pad, sign it, and write about teleconsultation. That is very important. Then consent. Previously, before 1996, the consent was not existing. Only written consent was not existing. It was implied that if any patient is going till the operation theater, getting anesthetized, that means that patient has given the implied consent for the procedure. But a young woman who underwent hemithyroidectomy and due to some side effect of anesthetic drug or allergy she had, which was undiagnosed previously, she died. Okay, so this law of written consent came into the grievous hurt. I'll tell you this grievous hurt it's a very interesting story with me only. One person who had a fight with his neighbor, he came to us with a small contused lacerated wound over his head. Okay, we sutured that wound. His CT brain was normal, everything was normal. Even though the relative was making noise that he should get admitted, he had a head injury. So we have admitted him for 24 hours observation. After 24 hours, he started complaining of earache. We took a ENT surgeon's opinion, and they were saying he's okay. Then he started complaining of loss of vision. We took an ophthalmologist opinion. They said he's okay. Then he said I have a toothache. So we took a dental opinion. They said he was okay. So what he was doing is he was just passing on the days of admission in our hospital so that it will reach the limit of grievous, that is 19 to 20 days of admission, so that he'll prove in court of law that the injury he had was grievous, which required 20 days of admission. So the people will try to fool you during your practice if you don't read forensic medicine like this. And that patient complained to police that we have not taken dermatologist opinion for the hair which he has lost on the incision. Drug interaction. Now I'll directly show the drug interactions to you. Warfarin with green leafy vegetables. If you give any patient who is having venous thrombosis, you have advised warfarin, and he's eating green leafy vegetables, then there will not be any effect of warfarin. This is a very common mistake done by physicians as well as surgeons who prescribe warfarin. Okay, because green leafy vegetables contains vitamin A, which counteracts the action of warfarin. This is day-to-day life practice you should know. Potassium chloride with spironolactone. Potassium chloride itself is a potassium. Spironolactone causes increase in body's potassium level, which causes hyperkalemia. We had one patient who arrested because of this potassium chloride, which was given to him, who was on spironolactone. Okay. Then there is a very amazing story with this theophylline and ciprofloxacin. I also never knew this till my MS time. Theophylline with ciprofloxacin. One patient who is a known case of asthma, he came to us complaining of urinary tract infection. My junior resident prescribed her ciprofloxacin for 14 days. He was taking ciprofloxacin, but on day 10 he came to us with seizures. We did CT scan brain, MRI brain, everything was normal. Neurology which was normal. Okay. After we took one physician reference, then he told that ciprofloxacin inhibits cytochrome P450, which inhibits the metabolism of theophylline. So we did his theophylline blood level, which was very, very high. So we stopped his ciprofloxacin and he was all right. So these are basic interaction. Like reading pharmacology is very interesting. That's what I just wanted to tell you about with these drug interactions. Reading history. Now we have so much of ready to read material, but previously people had struggled a lot to know the anatomy, because still now if you want to learn the anatomy you should have a dissection. Okay, and for dissection you will need the body, human body. Okay, and as you know, people don't donate their bodies for anatomical dissection even after deaths. So it's very difficult in this time also when people know much about everything. So just imagine at that time how the Vesalius, who is father of anatomy, has studied. He used to dig out bodies from graveyards. Okay, he used to take the bodies of prisoners who are like executed to death sentence. That's how he studied anatomy. Penicillin, how the discovery of penicillin happened. This Alexander Fleming, he was a very lazy person. Okay, he used to throw everything aside. Okay, so one day he was doing some research and then he was like exhausted. So what he did is he put all the petri dishes in the sink and went on a vacation. He came after 7 days and then he saw this petri dish, which was showing bacterial growth all over the dish except over the fungal area. And then he discovered that there is some substance in this fungus which is causing inhibition of the growth. That was penicillin. How nitrous oxide was discovered. Actually, nitrous oxide was discovered as a laughing gas. Okay, but in one party, one stand-up comedian was giving the comedy and and then he suddenly had some injury and his leg got cut, and he was under the influence of nitrous oxide. And at that time, this person was there who was like, nitrous oxide also causes loss of senses, and that's how the nitrous oxide is came to use like as anesthetic agent. Even biochemistry. Okay, if you don't have any uracil who is like coming in between your thymine and adenine, even biochemistry is fun. Okay, I'll tell you the important story about one of my guide, Dr. Aparna, who is a urogynecologist in Sion Hospital. Actually, she was having fat indigestion since her MBBS. Okay, but everyone was saying ki just because you are more concerned about getting fat, you are not eating fatty food, and that's why you are avoiding fat. Or after eating fatty food, you are getting stressed out. She used to feel dizzy and uneasy after taking fatty food. During her MBBS and whole MS, no one discovered that she is having some problem. Then she went to Stanford University for further studies, and at the Stanford University, they just did her urinary level of methylmalonyl acid. If you see odd chain fatty acid cycle, I don't have it actually, but if you see odd chain fatty acid cycle, there is a conversion of methylmalonyl CoA into succinyl CoA, which enters the Krebs cycle. Okay, so that requires vitamin B12. So she was deficient in vitamin B12. And second thing is methylmalonyl CoA was not getting converted to succinyl CoA. That's why she was having acidemia. That's why she was feeling uneasy. And this was diagnosed in Stanford, not during her MBBS and MS. Even microbiology. Microbiologists actually took a lot of efforts to discover many things. Like Wagner, these are just have a fun element. Like Wagner, who treated syphilis patient with malaria. The patient developed malaria, causing severe fever and killed syphilis bacteria. Then given the malarial drug quinine. Till that time, the treatment for syphilis was not discovered. So he knew that the treatment for malaria is there. So we use the malaria in that patient, and then he treated the syphilis. This Louis Pasteur, who discovered the rabies vaccine, what he did is he know how rabies is dangerous or grievous for us. So he used to keep a loaded gun in his laboratory while working on a vaccine for rabies. So if he or one of his lab assistants got infected, they were to be shot. These are all about non-clinical subject which we generally misses. Am I, am I audible?
Yes,
Okay.
there is a
So
slight lag,
these
but
are
it's
the
fine.
non-clinical subjects. Okay. So should I change the network?
Um,
No need, na?
no, I think it's okay.
Okay.
Yeah.
Okay. So this was all about the non-clinical subjects which we generally read and we avoid. Like we feel like all the subjects are ratification, like microbiology, pharmacology, anatomy, but they're very important in clinical aspect. Even microbiology, any patient who is coming with fever, you have to do his blood culture. You have to get a pus culture. You have to know which bacteria is growing. You have to know the culture and sensitivity of that bacteria. Okay, so this every subject is important. Nowadays what people knows is the other name for the bacteria or other name for the drug, but they don't know the proper use of that drug or proper use of that drug for which bacteria or which colony it is used generally. And then comes the third year when you start reading your clinical subjects, and whatever disease or whatever rare syndromes you read, you think that this symptoms, I do have these symptoms and I'm suffering from this syndrome. So I just wanted to tell you in the end that each one of you will be successful after, even after finishing of MBBS. If you don't go for MS, if you don't go for MD or further studies, even after finishing MBBS, you will be a successful person. You will be earning much more than you have ever imagined, unless and until you increase your goals of luxury. Okay, what should be our primary endpoint at the end of all this journey or all this dream is happy faces. How many patients are coming with sad faces to you and you are making them happy. That should be our primary endpoint. I think if we keep this only one thing in our journey important, then and only then you will enjoy whole journey. This will help you to decide your further journey. Except, sorry. So nowadays, while choosing post graduation, most of the people see that doing MS general surgery or doing MD medicine is like long working hours, sleepless nights. You skip your meals. So I won't be doing that. I'll do radiology or I'll do dermatology. That's why radiology and dermatology are now like highest scoring subject. Like the rank 1 to 10 people will take dermatology or radiology. Okay. So I don't think this should be the point which is deciding your further journey or your career, because this career you are going to carry on or practice for a whole of your life. Nowadays, most of the people, they don't get the rank what they want, or they don't get the branch. So they are doing whatever branch at their rank they get in. Okay, and that's what making or converting a doctor to a businessman. He just wants to see and treat the patient, give the medication. He's not having any human attachment, and we are missing this primary endpoint, that is happy faces. Have a social touch, that is observe as much as you can. During my MBBS years, I used to like I went to Baba Amte's Anandvan and some of the other social organizations. I never got involved in them, but I saw them. I observed their work. I just want to take out the crisp from their work, what they thought of and why they did this. So you no need to do social work from now only, from MBBS only, but you should have a social touch that will make you feel humanly, okay, and that will help you in your further journey when you see the patients, and you will definitely learn something new during this journey. As during my 5.5 year during my MBBS, I never used to speak Marathi. Okay, but I learned Marathi in first and second year. Then I did Marathi dramas, three Marathi drama, and one of them was like outstation at district level. We got third rank. That was face to face. Okay, I started painting T-shirt. Nobody in my family is an actor. Nobody in my family is painter. I started learning flute. I still play flute. I'm I'm continuing these classes since 4 years now. So at the end of this journey, you will come to know at like this is not the end actually of my journey, but you will see this patient. See this patient. She was the patient. She was having huge hernia with excoriation of the skin. Okay, and the post-op result. You can see how much happy she should be. You can imagine. Okay, so this happy faces will keep you motivated if you go to clinics. Nowadays, even third year, final year students, they're sitting in the library and reading the books. I think you should see more of patients who are going home or who are getting discharged. That will give you the most. Next is distressing journey. I saw these patients during my MCH surgical oncology. This first one, he's the patient. He had 2 by 2 centimeter lesion. So someone in Uttar Pradesh has advised him surgery. Okay, and the cost. So he spent his 6 months in managing that cost, and the malignancy has grown to this much, which was really inoperable. Okay. The second one, she's sister herself. You can see she's sister herself, and she ignored her lump in the breast, which till the fungation comes. So you will see such patients. They are really distressing. You will see because you can't do anything for these patients. Okay, but you can change their quality of life. Okay, I had a patient. She was suffering from cholangiocarcinoma, that is the bile duct cancer, which was involving the stomach. She was not able to eat anything since 6 months. Okay, and that cholangiocarcinoma was thoroughly like metastasized all over her body. But what we did is we just did a palliative gastrojejunostomy, that is the diversion. Okay, and she was able to eat everything by her mouth. She was discharged happily, and she lived for 3 months only. But in these 3 months, she went to Himachal Pradesh. She enjoyed her Manali trip, and she enjoyed her last time with her granddaughter. So she used to send her photos. I don't have those photos right now actually, but she used to send her photos. So such patients can inspire you to learn more and more, because my field, that is surgical oncology, is the field in which lots of research is going on metastasis. Yeah, it's also a disheartening journey when you see the doctors are beaten up by the patients. Nowadays it has increased a lot, and in COVID time, I don't know, just because the patient is alone, relative is not there, and nobody has a time to update the relatives, that's why this things is increasing a lot. But you should know your clinical knowledge, and you should have proper communication skill. Somebody of someone told, like, doctor patient relationship. Yeah, that's what is lacking nowadays. We due to the workload, due to like sleepless nights, we don't speak with the relative, we don't tell them what is with their patient, and that's what the reason I think these things are happening currently. After all sleepless nights in the library, as well as in the OTs in the ward, you will have a happy journey. This was my MS General Surgery photo. So, what is the future of this journey? Whatever dream you are living, the future is evidence-based medicine. That is, now nobody expects what is written in textbook has to be followed. They want the evidence behind that. Even the court of law wants the evidence. Now everything is getting tested again and again. Just because nobody is consenting in our country, the research is very low in medical field in India, but outside India, they are researching a lot. Second is degree-based medicine. That is, previously everybody used to go to MD. Nowadays, they want to see the degree of the patient, doctor, whether he's cardiologist, whether he's pulmonologist, whether he's surgeon. In surgery also, what is his subspecialty? What is his uh, super specialty? Skill-based medicine. How much patient you have treated well? How much patient you have operated well? What is the cosmetic result of whatever patient you have operated? Cost-based medicine. We generally in metropolitan cities, generally patient prefers the doctor who costs more, and in peripheral cities, generally they prefer the doctors who cost less. So obviously, coming era is cost-based medicine, and last is communication-based medicine. Yeah, really, communication skills are very important, because if you don't tell the patient what they are suffering from and what you are going to do with them, they will really harass you. They will really make you mentally ill. And communication is the only way you can keep your mind calm and patient and relatives' mind calm. So what we know is placebo medicine is generally a communication-based medicine, which will evolve in coming future. But last this video I listened many a times because it's only 1 minute video. I'll play.
Does it have a volume, Dr. Akash? Are there any wordings said?
Sorry.
Is there any volume in it? Yeah, we can't hear. You'll have to
Okay.
you'll have to go on top. Yeah, just put place the mouse on top. No, also you'll have to share your computer audio. So just go on top. And then those 3 dots, right, where you saw the chat option.
Yeah.
You can see, say, then in the drop-down, share computer sound.
Yeah, share computer sound.
Yes, yes, please click on that. And you can play that now.
I keep quoting my father all the time,
Yes,
and I'm
it's fine.
sure I've done this millions of times. One of the first things he taught me was, Man ka ho to acha, na ho to zyada acha. If things happen according to how you wish, that's good. But if they don't, that's even better. And I could never understand that. And when I asked him, he said, if they're not happening according to your wish, they're happening according to the wish of some divine force. And that divine force will never think ill about you. So you have to respect that as being better. The other thing he told me was, when I was struggling a lot in those times, I said, life is a struggle. And he used to say, so long as there is life, there is going to be struggle. I think if we accept this factor, that your life is never going to be easy. Something or the other is going to happen. So rather than then sit in some kind of despondency on that, be aware that tomorrow is another challenge, is another day which could turn out to be profitable, which may not, but eventually there will be another day when you can start trying all over again.
So at the end, I just wanted to tell you that this journey of your dream is really enjoyable. You can hear me, right?
Yes, yes, we can hear you.
Yeah. So at the end, I just wanted to tell you that this journey is very enjoyable. You can enjoy this journey in whatever form you want. Okay. And learn as much as possible. Textbook reading is very important. At the end, you must think that reading Robbins for pathology, reading Gannon for physiology, I can't write those answers, those big answers in the answer sheet. At the end, you can pick up some small book for writing the answers, but for knowledge, just read this standard textbook. These are very important. They'll nurture you in a way you will never imagine. Okay? And in the future, you will evolve as a good clinician. Thank you so much.
Thank you, Dr. Akash. Really, this was a wonderful session. And, I hope the scholars have also found this equally useful and enlightening. And I like the fact that you mentioned that, how you're concentrating more on a better way of living, right? It's not only about diagnosing, but also providing them a better life. Yeah, and I think that's most important. So there's a good takeaway for all of us, whether medical, non-medical background. So thank you so much for this. I'd like to open the platform for questions, and all along I've asked the scholars to post their questions. So we have a couple of questions, and I'll help take it up for you. So the first question, you can stop sharing your screen, Dr. Akash. So you can also then see the, yeah. You can ask.
Yeah.
Okay. So we have the first question. One of the scholars mentions that in this lockdown, we are away from studying and now not able to concentrate as much as they were, before. So is there a way you can guide them? I think it's more of a guidance. Is there any tips for them?
Actually, same here. Actually, we had a decrease, like working in Tata Hospital. We are not working for COVID patients so much because we have cancer patients, and cancer patients are that too very important because cancer increases in days. Okay, so we can't ignore malignancy, that is cancer. We can't ignore them. So I got so much of time. So how I studied in this period is not by books, by watching different webinars only. We also had so much of webinars, so I studied by watching webinars and going back to the library. You can go to the library and you can pick up any book you can read. Okay, right now I can show you. I'm reading this book. When I don't think so. Yeah,
Yeah, not very clear.
yeah. When breath becomes air. So I also was like, how to read. I was also stressed out, so I was reading two books: Sudha Murthy's Wise and Otherwise, and this When Breath Becomes Air. In this book, it's a very nicely written book for anybody who wants to read. So I read these books, which inspires me a lot, and then I'll go back to my textbook learning again.
Okay.
So whenever you feel stressed out, just read something else. Just go away from the study. That's what I told you in the slideshow also. Have some other thing. Like I don't know how to paint, but I still painted a T-shirt for my friend. Okay, that Chelsea. And then I don't know how to play flute. I started learning it. I took 1 year to blow it properly. Okay? But I tried. So have some different interest also where you can spend your time whenever you feel stressed or you don't want to read textbooks.
Yes. I think pursuing a hobby will definitely help.
Yeah, obviously. Sorry.
Yes. Okay, so there's one more question from a scholar who's in their first year. And he had not participated in ICMR research project since this was the first time interaction and the syllabus was really huge. Please guide us for next year ICMR research. He's asking if there are any suggestions of any topics of research from your end.
Actually, I don't know. I don't know your interest actually. If you want, you can contact me personally. There are various topics, but what is your interest and what is the subject you're working on? Because there are various subjects for research. Okay, we are doing so much of research in malignancy or cancer. I'll be able to guide you in that thing also, but I don't know how to study for ICMR research. If you want topic, I'll give you. Contact me personally. I just want to know your interest. Then and only then.
Maybe we can share your email address at the end of the session. So
Yes, yes.
yes, if there is. Okay, so the first year is regarded as the preclinical year. How much is the non-clinical subjects important in clinical or practicing years? I'm asking this question because I had neglected my studies in my first year. And if I start studying sincerely from second year, would it not affect my career? If I've not given much of importance to the first year, can I still become a good doctor?
Okay. Listen, I told you now, third slide was that only. We are evolving or revolving. You are not the only one who has neglected. At least you have realized it in third year. Okay. There are many people who never realized till they have come across the patient or got beaten by the patient or patient's relative. Okay, so that is very important. Never feel stressed out that I missed first year. So how can I cover up first year in second year? Study second year in second year. Leave the first year syllabus. Okay, you will read that syllabus somewhere or the other year in your career. Okay, and definitely you all are going to become a good doctor because you are a scholar. Just remember that word, scholar. You are the scholars.
Yes, so there's an extension of that question is how much is the first year subjects important for their next exam or their next year?
I think this
Are they all
question is not correct. Actually,
continuity
yes.
subjects? I mean, are they all like, they have
Yes,
through the years?
yes, definitely. Previously, they used to take anatomy, physiology for super specialty CET also. Now they have excluded these subjects for super specialty CET and they have included the super specialty subjects so that any person who is joining the super specialty will have knowledge of that subject previous to joining only. Okay, but anatomy, physiology, biochemistry, these first year subjects you can't neglect any time of your life. Okay, you have to read them again and again. I still have Gray's Anatomy, Canons, and Satyanarayan's Biochemistry in my laptop. Okay, whenever I want to read, I'll go through them because I'm a surgeon. Being a surgeon, you need to have a knowledge of anatomy and as well as physiology, better in gastrointestinal physiology. So these subjects are going to help you a lot in your whole lifetime. Even if you miss, you will read somewhere or the other whenever you need. So there is nothing to be stressed out.
So these books will be your friends for life, literally, right?
Yeah, obviously.
Yes. Okay. So as you said, in neurosurgery, mortality and morbidity are high. According to you, what are the pros and cons of choosing this field?
Basically, any space that's what my thought is actually. But basically, if any field, every field, like even surgical oncology, I chose, it has mortality and morbidity, say similar to neurosurgery only. But what I want is, I want everything should be in my hand. I should be able to treat that patient completely. Okay, in neurosurgery, you will treat the patient, but the recovery is not in your hand. Recovery, you just have to wait and watch. Okay, so that's what is the problem with neurosurgery, what I felt. But I have some of my friends who are who are doing neurosurgery, and they're doing very great. Okay, like neurosurgery has evolving field of functional neurosurgery, functional brain surgeries for patients who are suffering from convulsions, for children's 4 year, 5-year-old suffering from convulsions. So I think neurosurgery is also a great field. I chose this because I found many patients who are coming from my area are suffering from advanced disease just because of lack of knowledge. And neurosurgeon, as you see, neurosurgery is the vast field. and lot of seats are available all over the India. So you will find one neurosurgeon per city, one or the two neurosurgeon per city, but you will not find surgical oncologist everywhere because they don't exist, because we have only 64 seats all over the India. Okay, government recognized 64 seats. So per year, only 64 surgical oncologists will be coming out, and they'll be serving the country. Even in our Tata hospital, we have 24 seats out of 64, out of which only two people are from Maharashtra. Remaining 22 are from like South India, North India, from Delhi. So we have very less number of them. So you have to decide your interest and what your area of practicing needs, where you are going to practice, what the needs of that area is. If you want to be a successful surgeon or doctor.
Okay, that was very useful. Any suggestions for, any good online platform for the NEET PG exams, or suggestions how to go about preparing?
I think I'll tell you what I did during my internship days. I did my internship. I took externship to other college where the students' capacities high and work is less, so that I can read. And I read the textbooks only. I read Anand Narayan, I read K.D. Tripathi. Whatever I read previously, I revised them during my internship and directly solved the MCQs. Instead of reading the synopsis from MCQ books, I read the textbooks. I think reading textbooks is very useful. And nowadays, if you see the need pattern, it's changing year by year and it's becoming more clinical oriented. At our time, it was one liner or some of the other thorough like theory questions basically. Nowadays, it's becoming clinical oriented. So I think you should read textbook more than the MCQ books.
Okay. I'm from the 2017 batch, a scholar says, and we are the first batch going to give the NEET exam. I'm assuming it's written NEXT exam or NEET exam.
2017, okay.
17
Yeah.
batch. Could it be the NEET exam?
Okay.
And is
No,
it
obviously not. No?
not
You have not completed
NEXT?
your internship yet.
Yes,
No,
so
no, no.
it's written as
Acha, next. She's asking about next. Okay,
okay,
okay, okay, okay.
next
I
exam.
think next exam will come in 2000. I don't know, later.
Yeah,
It's
so
not
she,
this
yeah,
year
so
as well as it's not in 2021.
right. So the scholar says that theirs is going to be the first batch that will give this exam, the next exam.
Okay, so it will be clinical oriented only, same as the NEET. See, exam
Okay.
pattern, exam MCQs are not going to change. Only the pattern will change, or only the name of the exam will change. They will test you even if you give USMLE, even if you give MRCP. They will test your knowledge on clinical skills and clinical oriented questions only. They can't test anything else for an MBBS student. Okay, and I am glad to inform you that nowadays universities are adopting that OSCE pattern for practical examination also, so that they will test each and every skill of the student.
Okay. Another scholar has asked how to choose the specialty. At which year should I start thinking about a specialty?
Okay, so I think I started developing interest in surgery while I was in final year, because our final clinics were very good. Our teachers were very good, and I am always fascinated with that green scrubs. Okay, green surgical scrubs. I was always fascinated with those, so I just wanted to wear them and have for myself. So I chose surgery because I have interest and I understood the subject better. I don't believe in trial and error. What I think is medicine about. Like you will give one medicine, if it like benefits the patient or not, you don't know. I want everything in my hand. So in surgery, any hernia patient comes, you operate him, next day he'll be okay. No hernia. So that's what I want. That's why quick result I want, and that's why I chose surgery.
Yeah, I think it's what you want or what you realize you will want during
Yeah,
your,
during your MBBS.
yes,
What you enjoy reading, basically.
right. So here there's somebody who asked, what are the textbooks we must study in MBBS? If you have any suggestions, And, maybe you can just address how to maintain consistency in studying. And how did you prepare for your PG entrance?
Uh, this is the question I'll answer it properly actually. Textbook, I'll tell you what I read. For physiology, I read Ganon, TK for anatomy, BD Chaurasia for biochemistry, Satyanarayan, KD Tripathi for pharmac, micro Anant Narayan, then FMT Reddy, and what are these? Patho, Robbins, as well as Harshmon. Harshmon for the exam because you won't be able to write answers in the exam with Robbins. Okay. Then all these textbooks are standards for clinical subjects. How you prepare for NEET? I think you should prepare it through the textbook. That's what I told you previously also. But what I did is I used to solve the MCQs after reading the text, and I used to revise that topic again in next week. Like suppose from anatomy, I read brachial plexus in the previous week. So I'll revise it some or the other day, just before sleeping or just before starting my study in the morning. I'll revise that brachial plexus topic again in the morning and in next week, because nobody is born genius. You have to revise things for learning and for understanding better. Okay. And second thing is, whatever you don't remember, just write a sticky note and place it on your study table and read them repeatedly for 5 to 6 days till it becomes your long-term memory. As soon as it becomes your long-term memory, you can remove those 5 sticky notes and attach new one. That's what I did.
Okay. I'm sure you'll have more tips, but, we'll have to.
Yeah, obviously.
Yeah, obviously, yeah, we'll have to do it pretty big. So we're already over short time by a minute. So quickly, we'll just address the last few questions. Is there any thing that you can tell them about NIMHANS and how to get into it? Any suggestions or tips for NIMHANS?
I think she's the one who asked about neurosurgery, I guess. She or he. Okay,
There
Nimans,
are two of them
actually,
who have asked about NIMHANS.
Nimans. Okay,
Yeah,
okay. Actually,
institutes
I
like
prepared for
NIMHANS,
Nimans.
yeah, offer a 6-year
I
MCH and DM program after MBBS.
Yeah, I know.
Yeah, so is
I
it
know.
necessary to do
Instead of going,
MS or MD before this is what they're asking also.
look, if you are pre-decided for neurosurgery, like during my MBBS, I was decided for neurosurgery and I was about to give NIMHANS, but I was not prepared for it. I gave it, but what my rank was, I don't know what was the rank. Rank was very like back. So I took MS General Surgery in my dream college, that is KM Hospital. Okay, and during my MS General Surgery process, I realized that I'm more interested in surgical oncology than neurosurgery. If you don't want to change your interest, if your interest is fixed, then you can go with for Nimans. Nimans, I think basically you read thoroughly anatomy and physiology, nothing else. Nothing else they'll ask you. Anatomy, physiology, and psychiatry. These three subjects commonly they'll ask you.
Okay. You have told us about clinical posting, the importance of clinical posting, but every time I go to my ward, the wards, my seniors always tell me you are in your second year, so you better read Robbins, then only come to the wards. What should I do?
No, second year, I'll tell you for clinical posting, second year is for history taking. Third year, first part is for clinical examination and final part is for diagnosing. Okay, this is how the clinics should be decided. In second year, you just go to the ward and take the history of random patients, not the patients which were allotted to you in the exams. Like generally, we go to surgical ward, we'll take the history of, we'll find hernia patient, sister hernia patient, where is the hernia patient, where is the hydrocele patient, and we'll take their history only. I think that is not important. You go and just learn the art of history taking in second year, nothing else. Okay, you can't clinically examine the patient. What I feel is you should focus definitely on your second year subject, but history taking you should learn in second year. In third year, first part.
Yes, you can hear us, Akash?
Yes, yes.
Yeah, okay, we lost you for a bit. Okay. Do you have any suggestions about the coaching classes that they should attend, or how can they balance out studying on their own?
I'll tell you there is no need of going to any coaching class basically, but you can definitely join any MCQ series or any correspondence course which they have. Okay, because if your teachers are good in your college and you are understanding what they are teaching, or you are understanding on your own, then there is no need of wasting time in coaching class, because people are getting exhausted by attending college lecture plus that foundation course on Saturday, Sunday. They're wasting that Saturday, Sunday in coaching classes. So you'll not have time for self-study. So I think you should spend more time on self-study, because as many times you read, you will realize that you are understanding that concept uh, like nicely.
Okay. I'll just take the last two questions or so. A few of them have asked you about USMLE exam preparation. I'm not sure if I've got that
Yeah,
right.
yeah,
You,
yeah.
yeah.
Actually, there will be another lecture on USMLE, how to prepare for USMLE. But you just read your subjects and join any course. If you really want to go for USMLE, go it in your MBBS only, because and that too in first or second year only, because USMLE step one is for first and second year, and step two is for third year. Okay, so join it in first or second year. At the end of second year, even you can give it in your third year. If you want to prepare, please join any USMLE related course, whichever you feel is economical for you, because they're very costly. And if you really want to practice in US, I think you should better serve India only, because we need more doctors.
Yes, definitely agree. So there's another, I mean, there is another question that says, what can you share any process or exam that for which, you know, an Indian doctor has to do to get to Stanford? Okay, because you mentioned one.
Listen, Stanford University, you have to complete your post graduation here, and for fellowship or whichever topic you are interested in, you can go to Stanford directly with letter of recommendation, or whatever you are doing, like MRCP, MRCS, whatever is requirement, you can go through that exam during your post graduation also. Okay, so going to Stanford is not a big problem. Okay, but going to US is very big problem. You have to crack USMLE for US, but Stanford University, you can easily pass. You can easily take fellowship anywhere. Okay, Stanford. I don't think it's a problem. You
Right.
finish your post graduation first in India.
Okay. Is there any other suggestion? I mean, is doing PG the only solution after MBBS, or are there other options? What else can they do other than PG after MBBS? Yeah, can you hear us, Dr. Akash?
Yeah. So one of my friends is IS. You can go for UPSC also, and you can go for rural practice also. You can go for anything you want, but I think doing a post graduation is very important, because previously that MBBS used to teach you lots of clinical skills, but nowadays it's all become theoretical. You will learn theory during your MBBS, but its clinical application you will learn during your post graduation only. So I think doing post graduation is very important.
Okay. And how to improve clinical acumen at home as we cannot go to postings right now?
They read textbook first. I think this is the time which is going to end in 1 or 2 months. Obviously, in till November or December, I think you will be able to go to clinics with all possible precautions. So learn textbook first. How much is possible, spend time with the textbook. Okay? And yes, you can watch MRCP practical exams video. They conduct their exam using OSCE. These videos are available free of cost on YouTube. You really want to learn clinical skill, how to examine CVS, RS, abdomen, everything is there on YouTube.
Okay, and one last question. Can you tell us about DNB as a postgraduate course instead of doing MD, MS?
It's same as that of MD and MS. No difference in DNB, MD or MS. Okay, there is no difference. Anybody who is not getting MD or MS degree will do DNB. Okay, there is no difference. They'll come across the similar patient. They will practice similarly as of MD, MS. There is no difference. It's just a national degree. DNB is a national degree and it is recognized abroad also. But MBMS is not recognized abroad. It will be MBBS only.
Okay, so I think with this we will close the Q&A session, Dr. Akash. Maybe we can, if you don't mind, you can type your email address in the chat box to everyone if you're okay with receiving questions. Yes, and maybe a few which we may not have answered fully or a few that they may think of later, then they can write to you. So scholars, please reach out to Dr. Akash in case you have any questions that you would like answers for. And regarding your renewals, there was a question. You would have received an email from the scholarship team. But however, in case of any doubts, please call the number on our website, or you can write to scholarships@ffe.org. Email on the chat. Please, you write to the scholarship team and they will be more than happy to assist. Okay, so thank you once again, Dr. Akash. Have you sent the email address or we can share it? Yes? Okay, all right. So thank you so much once again. And thank you, dear scholars. Thank you for your time. And I really hope you all have a lot of takeaways from this session. It was really something very useful to all of you. Okay, thank you so much. Thank you, Sushma. Thank you, Anandita, for helping.
Thank you, Dr. Akash. Thank you
Thank you.
all.
Yeah. Thank you, everyone. Have a good evening.